As some of you may know, about a year and a half ago, I started having this radiating nerve pain coming from my neck and was having a lot of issues with it, weakness, numbness, pain. And recently that pain was getting a lot worse, so I finally met up with actually an old friend of mine, a neurosurgeon in Nashville, to find out what my options might be. So I'm back in Nashville. I just had another MRI on my neck, and I'm heading to see Dr. John Spooner.
I understand you're here with some neck pain and some arm pain.
A year and a half ago, I just started to notice a tightness, constant muscle spasms. It just wouldn't go away. And then after a few months, I started to get paresthesias down my arm and was doing acupuncture, chiropractic massage, and rehab exercises 3 times a week. I genuinely thought I was better. And then 2 weeks ago is when the pain was like a dagger, and it was worse when I would try to sleep at night. And that's what inspired me to come see you.
While we do an exam, pull towards you, push away. That's good. Okay, so no weakness anywhere. Why don't we take a look at the MRI? There's a lateral portion of something that's pinching the nerve right there. And on your old MRI, it's getting pinched a lot more. I think you have a better looking MRI than you did a year ago.
What role could or does a possible injection play?
It's an option. I also think I've seen people do traction therapy and get better. The nerve root is compressed, and when you provide traction, you make that space bigger. Let's try the traction. If that doesn't work, we'll try an injection, and we'll take it from there.
Thank you. Appreciate it. And you know, Drew, one of the reasons I've wanted to share this journey with people is you've seen it. It's just anyone who's ever had a compressed nerve, whether it's in your lower back or your neck, and just it can come and go, and then you think you're out of the woods, and then it comes back, and you know, it's interesting because 4 weeks ago I could not get comfortable, and it was just constant.
I'm with you every day almost, and I mean, I've seen you deal with this now for months and months. I know how much you're suffering with it, and you're trying everything. You're doing all the right things.
And that's one of the things I want to, make sure our viewers understand, people who are dealing with it, is there's so many different modalities. I've still been getting great work with the guys at Body Structure, chiropractic manipulation, acupuncture. But I tried this new cervical traction, seeing a physical therapist in Nashville, doing some new movements in the traction. It is amazing that in my particular case, after doing this now for the last 3 weeks, there's so much more relief after starting that now I can actually sleep at night and get through the day without, quite frankly, there were points there where the pain just constant. I call it the dagger.
And for our viewers, when we talk about traction, just like the word traction, what this is doing is pulling tissue apart to open up those areas that are pinching on your nerves, giving you all this discomfort.
Well, and that's what's so interesting that I've learned through this whole process. If you have a nerve that is impinged or being pinched, it can be literally the weight of this card. Less than that, the slightest pressure on a nerve can cause excruciating pain, numbness, weakness. And what you're trying to do is do anything to just open up just enough space that nerve, as it travels through what we call in medicine the foramen, that it just take the pressure off the nerve. And I will say, I'm going to continue this treatment for 3 more weeks, see where I'm at. And this is probably my last step here, cervical traction. If I had to do an epidural
maybe
injection.
an injection, right?
And if I do not plan to be in pain 2 years from now. Let's put it that way. But the takeaway here is, when you have people you trust, then you know who you can turn to. Maybe it's in a moment where your pain has gotten so severe, or you've developed severe weakness or numbness. You got to have people in your corner that you trust, and I've certainly been blessed to have that. We'll be right back.